Maharashtra is a highly urbanized state of India. More than half of its capital, Mumbai, lives in slums.
Mumbai city is having highest population density, more than 23,000 population per square kilometer. Around 30% population is a migrant population coming from various states of India. In Mumbai, some of the wards, more than 90% population is slums.
G North and M East wards of BMC have the largest number of slums in Mumbai and are associated with poor development indicators.
Health indicators in the country have improved considerably over the last 2 decades, and specifically for Maharashtra. But the narration changes when one looks at granular data, and here I refer to the urban areas and within them the urban informal settlements. This is where we see 3 types of challenges. One is the heavy and high density of urban population in these underprivileged settlements. Number 2 is the epidemiological trends, which shows the coexistence, for example, of stunting and obesity in the same areas that we are referring to. And the third is the parallel trend that we see of non-communicable diseases, along with the threat of communicable diseases also being available in the informal settlements.
The population here are highly vulnerable.
What exactly are vulnerabilities? The National Urban Health Mission defines vulnerabilities as residential, occupational, social, and health vulnerabilities. These vulnerabilities are factors that push the household into greater risk of falling ill.
Residing in the slums is challenging, especially during monsoon. Unplanned and crowded housing, poor ventilation, irregular water supply, hazardous housing location, unhygienic drainage, and open defecation are the common features of these and most slums.
मेन अडचणी म्हणजे इथं कुठल्याच याला ॲड्रेस नाही आहे. फक्त ॲड्रेस म्हणजे इथं मदीना मस्जिद, हनुमान मंदिर हेच ॲड्रेस आहेत, बाकी काय ॲड्रेस नाही इथे.
The lack of basic amenities contributes to adverse health outcomes, like the spread of infections and chronic ailments. Social vulnerability is seen evidently in the slum population. Poor levels of education, compounded with a lack of legal identity proof and the non-availability of ration cards in the majority of households, results in a lack of access to many welfare schemes of the government. Nearly 1/5 of households are either single parent, child, or women-headed.
मेरा नाम फरहीन है। हम लोग बचपन में गांव में थे, यानी यूपी में थे, और हम लोग का गांव बांदा जिला है। यहाँ आके हम लोग का एडमिशन नहीं हुआ स्कूल में, इसलिए हम लोग स्कूल नहीं गए।
School dropout is not a recent phenomenon here. Though education is an aspiration in most households, the school dropout rate is very high amongst the slum population, especially the females.
हाय, मैं एमडी सोहेल आलम हूँ। मैं बिहार सीतामढ़ी जिला का रहने वाला हूँ। मेरा खुद का दुकान है, बिजनेस है, और भाई लोग को पढ़ाया, मैं खुद अनपढ़ रह गया हूँ।
Slums like Dharavi are massive economic centers, and many residents are dependent on them for livelihood, although it is hazardous in nature. A large number of this workforce is engaged in the unorganized sector with poor job security and working environment.
मैं कोरोना के वजह से तकलीफ हो गया, मेरा ड्यूटी छूट गया। मेरे पास पैसा नहीं था, खाने का प्रॉब्लम था, बच्चे लोगों को पाल नहीं सक रही थी, इसके लिए बिजनेस चालू करी। बिजनेस चालू करके अपना गुजारा कर लेती हूँ, बच्चे लोगों का पेट पाल लेती हूँ।
The pandemic and post-pandemic period have affected the unorganized sector considerably, resulting in a dramatic economic slump amongst this population. For most of the dwellers in these slums, the health services are inadequate, distant, or unaffordable. Although cities have the advantage of having multiple healthcare institutions, Lack of resources and absence of health insurance prevent them from seeking quality health care. Sometimes, poor utilization of health facilities poses concerns too.
माझं नाव कविता सुरेश कोळेकर आहे. मी आशा आरोग्य सेविका म्हणून काम करते. माझा एरिया ट्रान्झिस बी आहे. तर तिथे मी जेव्हा कामाला जाते ना तर ते लोक पारधी समाजाचे लोक जास्त आहेत. तर ते लोक धंद्याला जातात. ते सकाळच्या 8ला घर सोडतात, ते संध्याकाळी 8ला येतात. मग जेव्हा मी जाते तेव्हा ते लोक कोणच भेटत नाहीये. मग त्यांची लहान मुलं असतात ते त्यांच्याबरोबरच घेऊन जातात.
वो बच्चे के मेरे बुखार उखार रहता है, इसी वजह से नहीं लगवाई. 7 महीना का थे, 6-7 महीने का तो सुई लगवाई हूँ. और टीका वाला जो काट है वो गांव में है. और अब सुई बराबर लगवाऊंगी. जो सेंटर पे आते हैं इधर मंदिर पे, उधर लेके आऊँगी तो लगवाऊंगी बराबर से सुई.
मेरा बच्चा पहले 7 किलो का था, अभी बीच में वजन कराए तो डॉक्टर लोग चिल्लाए, बोले 6 किलो का बच्चा है क्योंकि आप बहुत पतला दूध पिलाते हैं. दूध थोड़ा अच्छा पिलाओ, अच्छी क्वालिटी का, मगर क्या करेंगे, पैसा नहीं है तो इस वजह से पतला पिलाते हैं. आदमी भी घर पे लॉकडाउन से पहले लॉकडाउन लगा था, जभी से घर पे है. घर में छोटी सी दुकान है, उसमें कुछ नहीं होता है.
मेरा नाम रज़िया बानो है अंसारी. मैं साल में 5 डिलीवरी करती हूँ. 20 साल से कर रही हूँ ये काम. मैं दाई बाई का काम करती हूँ. दवाखाने में ना वो लोग जाते हैं ना तो डायरेक्ट सीजरिंग का बोलते, तो वो लोग डर के मारे दवाखाने में नहीं जाते, हमारे पास आते हैं, तो हमको जाना पड़ता है.
Identifying the areas of multi-sectoral activities, recognizing the role that local partners and communities can play, and all of this in the context of differentiated budget availability and administrative framework could possibly hold and provide the answers to the issues that we are grappling with, which is which factor contributes most to the vulnerability and what can we do to address them. It is therefore in this context that UNICEF Mumbai sought to understand the granularities of the urban informal settlements in our joint endeavour with the government of Maharashtra, especially the NUHM, which is a National Urban Health Mission, and the municipal corporations of the state, including the urban local bodies, to chart out and support them in the common vision for primary health care in the state.
There is no simple solution to such a complex system. If we are to achieve the goals of universal health coverage and primary health care, then we have to involve the biggest players, communities. We need to understand their needs, their priorities, and their aspirations.